A great way to release the scalene fascia, the platysmal fascia, and all this lateral neck fascia into the shoulder is this slow technique using the top of your hand. You just come in basically in the supraclavicular triangle here, so just behind the clavicle, and I'm going to take a soft contact with just below my knuckles, and I'm going to just push straight down in like this. I'm going to keep the head gently twisted to the opposite side, and my force is going to be down that way, but also slightly this way, but I don't want to slide over the tissue. This takes a lot of patience. You want to move very slowly, and your force will be gradually increasing. And as the tissue softens, your hand will start to slide down toward the table. So I'm using that surface of my knuckles right there, so it's comfortable for the patient. And you can maneuver the head slightly with your opposite hand just to feel where that you get the most ease in the tissue. I like to find that point. And then just slowly, you're just raking the tissue back down toward the table. Very slowly. I love this technique if the patient has an acute neck problem. This is also great if they have shoulder impingement, because this will get into the supraspinatus fascia. And you just move very slowly. The position should be comfortable, and that's part of the treatment, just finding a position that the patient is comfortable in and holding it in that space. You see, my hand is moving ever so slowly. I mean, it's just millimeters, not even, until we get all the way back into the meat of the trap. And as I go here, I can push a little harder as the tissue softens. I use this for radiculopathies into the arm, acute disc problems in the neck, acute facet problems in the neck, again, like shoulder impingements. Just opening this fascia up can help with a lot of conditions involving the neck and shoulder. And it's just like, imagine you're peeling the fascial layers back away from the front of the body, and you move ever so slowly. Look, I've only moved a matter of a few millimeters. So I got another few minutes here that I could do until I'm at the actual end of the road, so to speak. And then once you finish with that, I like to start to slowly come up the neck. And then the same thing, moving at that same slow pace, and then to add a little bit more of a distractive force on the shoulder and neck, I'm going to come across with my opposite hand and push here. Slowness is the key. If slowness is even a word, I don't even know if that's a word.
It can be a word.
Going slowly is the key. Does that feel okay?
Mm-hmm.
Amazing technique for loosening the neck. And you fix a lot of things using this method.